Andy. And
I'm Chris. I'm Chris.
And we're the Reservoir Geeks. And we have a good friend named Dr. Daniel Zamora, but we call him just
I think he's below us. Is he below Andy?
Not intellectually.
Yeah, we have our good friend Danny here.
Danny is an infectious diseases doctor up in Seattle where all this kicked off. Not blaming Danny for it, though. So, Danny, why don't you just tell us a little bit about yourself?
All right. I'm Danny Zamora. I'm an infectious diseases fellow right now in the fellowship here at the University of Washington in Seattle. It's my third year of fellowship. It's my last year, so in July I should be graduating to attending level infectious diseases doctor. Although technically I am able to see patients on my own in terms of infectious disease stuff. But and before that, I did residency at UT Southwestern in Dallas, Texas. That's where I met you two knuckleheads via my wife, Casey. And
we're all med school dropouts.
I'm a junior college dropout.
Nice.
I also experimented at junior college. Yeah.
I was there for 3 years, and honestly, I've been back recently. Just to come and visit sometimes, and things have changed a lot over there. But before that, I lived in Arizona. I did medical school in Tucson, Arizona, and undergrad in Tucson, Arizona, at the University of Arizona. You could say I'm an Arizonan at heart. I've been there since I was like 2 years old. But that's me in a nutshell.
Okay.
So you're in
Seattle.
You're
also really cool, and we like you a lot.
Yeah, that too.
I like that. That's nice. If you could put that at the end of the MD, like
real cool guy.
Cool guy.
Cool.
Or CG.
Yeah.
Okay, so you're in Seattle now, and Andy said that's kind of where everything kicked off. What was your day-to-day before all this started? Like, what did you do daily?
Yeah, it's again my third year of fellowship. I'm doing a lot of research these days. I focus mainly on viral infections in immunocompromised patients, and specifically the patients that have actually undergone bone marrow transplants. So they've gotten all this chemotherapy, they've gotten these transplants, and they're very, very prone to infections. Doing research, kind of more bench-based or lab-based, and occasionally I would still go and see patients. I have my own clinic at the bone marrow transplant hospital, and I occasionally see patients within the hospital on the inpatient service too.
So this is pretty much right in your wheelhouse, like when all this started, like this directly affected your, I guess, patients, the people that you see normally.
Yeah, we were pretty concerned over here. They're one of the most at risk populations for bad outcomes for this infection, and so we acted fast. We tried to put all these precautions in place for patients. We, bringing them into the clinic less often so they're not exposed to other patients as frequently as they are, telling them stay home. The Fred Hutchinson Cancer Research Center, where I do my research, which is affiliated with the Seattle Cancer Care Alliance, which is the hospital part of that whole entity. We're one of the first that actually instituted the whole work from home, social distancing thing. And afterward, Amazon followed suit. And, I think we did this really early, and it was a good thing.
Because in the US, Seattle was pretty much the main, like, kind of puncture point for the US, right? Like, that's kind of where everything started. But you all managed to kind of slow it down pretty quickly, I guess. Oops, we lost you.
Lost me?
Oh, there we go. You're back.
Oh, okay. So some of this
you got real sad, and then there was no audio. Like, oh man, this is a real tough question.
Well, some of it was kind of luck. We have a lot of studies going on in Seattle. We're a very big infectious diseases research kind of hub. And we have this research project that is tracking influenza throughout the city. And, we were able, one of my colleagues was able to actually pick up this, SARS-CoV-2, the virus that causes COVID, because of that study. And yeah, we picked it up really fast, and we were able to act fast on it. And I think we're lucky in the sense that, our leadership is one that actually believes in science. So
Yeah, be nice if the rest of the country would follow suit.
All right. Well, if you're ready, we can just jump right into questions.
Yeah.
Andy, did you have any questions before I get?
Yeah. Can you just give us like a brief idea of what it actually is, COVID-19?
Yeah. That's a good place to start, actually. So we have to separate the disease from the virus. I think is the most important thing to do. So COVID-19 is the disease process that is the result of the virus called SARS-CoV-2. And it's called that because it is actually in the same family as the original SARS outbreak that was back in early 2000s. And it's in the family called coronaviruses, Coronaviridae. And corona coming from from meaning crown, because the virus itself has all these little spikes on it that looks like, makes it look like a crown, pretty much. And so, so at any rate, we have the virus, which it can be spread via respiratory droplets, and lead to this COVID-19, which is the actual disease. COVID means coronavirus disease. That's the shortened version of that. And we add the 19 at the end because that's when presumably it all started. And then we could probably talk about the whole kind of progression of disease from when you first get it to when you start to get symptoms. But I'm sure there'll be questions about it.
Oh yeah,
so we can jump into that.
Yeah, actually, the next big thing we want to talk about is what does it feel like to get it, or how do you know you have it? What are the first symptoms? And I know that kind of varies depending on the person, but in your experience or what you've seen, what typically it tends to be the first thing that people will notice.
So it's probably pretty likely that they won't notice anything. There is going to be a lot of patients that end up having COVID, and they never realized it because they have what we call asymptomatic infection. But if you do get any kind of illness, it's a very wide spectrum of diseases. You can go from anywhere from a mild kind of flu-like illness, and it really is like shares a lot of the same symptoms as flu. You get a cough, you get fever, the muscle aches, some headaches. The one thing that maybe kind of distinguishes flu from COVID is that eventually it leads to some difficulty with breathing, shortness of breath. By that point, you're getting kind of towards the more severe parts of the disease. It actually has on average an incubation period of about 5 days. So when someone gets infected, they could be feeling like $1 million up until the 5th day, where they start to maybe get these fevers and other things.
Are there any early signs? Like, I'm a hypochondriac, so anytime my throat sort of itches, I'm like, shit, I think I got it.
Yeah. So you do. There is a sore throat is one of the symptoms that you can get. But the interesting thing is that it's never it's never concrete. It doesn't follow a certain pattern. People can get one symptom first and then get the next, later, and then vice versa. One other kind of interesting symptom that folks have gotten has been loss of smell and loss of taste. But that actually, if you think about it, back like when you've gotten like run-of-the-mill flu, and I mean, I think that's pretty common that people actually lose their smell and taste. But and there is very rarely there's some gastrointestinal or GI symptoms like diarrhea or nausea and vomiting.
So the respiratory thing is the big thing, because I guess because some people had, we've heard stories of people that have been tested positive and they've had real mild symptoms, and they've said that maybe some real bad body aches and high fever, and then after a few days gone. And then others, like total other end of the spectrum, just insane difficulty breathing and eventually death, stuff like that. So because it kind of runs the gamut, huh?
Yeah, it really is. Some of it does kind of depend on your overall kind of underlying health condition. One of the things that we're finding more recently with studies here in the U.S. is that unfortunately folks that are obese and overweight are more at risk, and that's not something they actually picked up in China, because there's not a lot of that over there.
Yeah.
Well, great.
Yeah. You and me both, brother. I gotta. It's so there's some at-risk populations outside of just the patients that I see, the cancer cancer patients and things like that. But from the 5 days that you start to get symptoms, about 5 to 7 days after that, that's when things really go downhill.
Okay.
And yeah, I would say that there's two big, I guess, stages of the infection. The first stage is like the actual viral part where you're, having some of these symptoms of fevers and whatnot. But then the second stage is your own body kind of responding to things, and it's more of inflammation. And that's what the inflammation is what really puts people kind of on the other side.
Because it's all how their body happens to react to that.
Yeah.
Because there have been, I guess, some issues or cases with, I guess, sepsis, where the body kind of turns against itself, but that can happen with anything, though, right? It's not necessarily just exclusive to COVID.
Right. That's absolutely right. But there is kind of this hyperinflammation that's related to COVID, like specifically. So it's different from other viral infections because we all get other coronaviruses.
Mm-hmm.
There's other seasonal coronaviruses that don't do this kind of picture where we can eventually end up on a ventilator.
Yeah.
Now, if you've experienced mild symptoms but no fever, how do you know if it's COVID? How do you get tested for possible antibodies if you only have mild symptoms?
That's a good question. Right now, testing's a big issue. It's been all over the media. We're trying to kind of catch up with that. So active infection is different from testing for antibodies. Antibodies tells you that you've been exposed to it sometime in the past. So that's not really going to help for folks that have active, symptoms and infection. The thing that really will diagnose that is the some molecular testing where they stick a swab up your nose, and that takes a couple of days to come back. But unfortunately, some places are still limited, and what has happened in a lot of places is that if you think you have it, you probably have it, and you should just act like you do. Stay at home, to prevent infecting others. If things get really bad at home, where you start to experience these, the shortness of breath and whatnot, then call ahead to your local emergency department and discuss those symptoms, because they might actually tell you to either come in or maybe just try to tough it out at home.
Who would you suggest? Let's say somebody is actually having symptoms and is fairly positive that this might be what it is. what should their first step, like who do they call first? If they have a general practitioner, or they try to go to the hospital first, who do they contact?
Yeah, and if they have a close relationship with their primary care doctor, I think that's not a bad thing, because eventually they'll get looped back in, to have some follow up. After if they end up going to the hospital, they should always follow up with their primary care. But so that's not. Yeah, we should probably start with your primary care if they're reachable by phone. If that's not a possibility, actually, most hospitals these days are having dedicated separate lines for concerns about COVID, and they'll have nurses and other folks on the line that you could talk to about your symptoms. And
so you could do like a teleconference type thing. Okay.
Yeah.
So I'd seen somebody had mentioned that they had kind of said, maybe see if you could talk to somebody that can just talk to you over the phone and tell you whether or not you're headed this direction, or if no, I think you're okay, you can stay at home, that type of thing.
Yeah. Definitely better to do that and kind of avoid the whole WebMD thing.
Yeah. All right. Someone asked, I heard it's worse than a cold, but not as bad as the flu. Is that true? And if so, what's the big deal? Like, where does it fall?
Well, it all depends on, again, your risk of bad outcomes. Right now, I mean, you've probably seen on the news that one of the experts that's been helping guide our administration, Dr. Anthony Fauci, who he is the head of the NIAID, which is the infectious diseases part of the NIH. And he's actually said this specifically. He said that it is 10 times more deadly than the flu. So there is a difference, and in terms of like early symptoms, it's hard to tell them apart, really. So, but it's just all about the, what could happen. That's what makes people worried.
Hold on, let me see here. Now China is reporting no new cases. What does that mean? Is it done there? Will it ever be done here?
Yeah, that is one of the $1 million questions, right? I think we have to take what they say with a grain of salt, and unfortunately, there was a big possibility that when this all started, that they may have been underreporting cases, and so that kind of led to our we didn't understand much in the beginning, and we were just relying on everything that they were telling us. So that no matter what, so China actually undertook some of the more extreme measures of social distancing, locking folks indoors and whatnot, and but no matter what the social distancing measure, as soon as you lift those regulations, you're going to see most likely an uptick of cases again. Mm-hmm. And I will say though, you need to also, or folks need to realize that when they're testing for the virus, they're actually just testing for genetic material. So if they find it again, it may not necessarily even be live virus. It may be just kind of dead stuff that's kind of floating around. So, so you've probably seen some reports out of Korea where folks are testing positive again, and it's hard to say whether it's something that is going to be relevant or not.
Now, is that true that so like the flu you can really only get once, like in a cycle? But I've heard that with Corona or COVID, you can get over it, and then get it again.
Yeah, so that's kind of one of the things that I was kind of alluding to with the Korean studies of recent. But one thing, so there's been some animal studies that have shown, and these were macaques, which are like a type of monkey, where they didn't get infected again. Like there was no evidence of it at all. But then now we're getting these reports from Korea about patients who are popping up positive with positive tests again, and what it's the thought is that it might not be that they're getting infected again, but that they're actually reactivating the virus that they had in the first place. And that has to do kind of with sometimes viruses can find what are called sanctuary sites, so they hide out in places. And for this virus in particular, it's kind of funny. One of the sites that they found has actually been testicles. So
Great.
yeah, it hangs out there.
I might have those.
Man, I touch those more than I touch my face. Mine, not Chris's.
And sometimes they touch your face. That's real weird.
This is pretty recent, but Trump cut off funding to the WHO, and making claims that they've failed in their initial response to the outbreak in China. What are your thoughts on those claims? What could a severe reduction in funds to the WHO do to the world?
Yeah, that I think there were multiple people maybe at fault with what happened. I think he's probably thinking mainly U.S. centric. That the response in the U.S. it could have been better, and honestly, there was the part on the WHO's part where there was maybe some favoring of the Chinese data and suggesting that maybe there is no human-to-human transmission, and so some of our earlier measures may have been because of what the statements that they made.
Mm-hmm.
But then the first measures that we ended up taking here in the country were closing off all travel to China, and honestly, once one patient comes from China to the U.S., that's all it takes. And so the measures about closing off all travel, they really didn't matter. And who was actually doing what they do in terms of just following the science. That's what the science showed at the time, was that there was no evidence of human-to-human transmission at the time. And unfortunately, there was some other issues with testing and the WHO offering tests to the US, and we didn't take those tests, and then we fell behind on testing. So lots of people may be at fault here. And I don't think that this is a good time to be defunding WHO, because there are other parts of the world that are likely relying on the types of things that they do for them.
Right.
Let's see. So early on, there were reports about ibuprofen. What's the new data now? Is it safe to take ibuprofen?
Yeah. So a lot of the issues with that actually came from there was a statement made by the French health minister where he said, you should avoid taking ibuprofen because it looks like there's worse outcomes for people that take ibuprofen that have COVID. In general, ibuprofen's a drug that's in a class of medications called NSAIDs. These are medications that are used for pain relief, and they come with a lot of side effects. They can affect your, they can cause ulcer disease in your stomach. They can cause kidney disease. And so if you add that on top of having COVID and all the things that COVID can do to your organ systems, that's probably why, you're maybe seeing a little worse outcomes. Is you've got kidney damage already from the COVID already anyway, from sepsis from COVID. But then adding the ibuprofen on top of that is just going to do more damage. So it's not necessarily that ibuprofen was predisposing folks to getting COVID. In general, though, in the ICU and for any kind of infectious illness, we prefer Tylenol, in moderate doses to at least control fever. You shouldn't avoid taking Tylenol just because of the concerns for side effects and whatnot. Because if you're having fever and you're feeling miserable, take it. it's going to help.
Yeah.
Since we're talking about fever and medications and stuff, I had seen a post recently that said, with the fever that, if you can stand it without it getting too out of hand, to go ahead and let it progress, because that's your body fighting off the virus. What's your take on that? Should you take medication to fight the fever, or let it burn hot for a little while?
Yes, take medicine. Your body's going to do what it's going to do in terms of fighting the infection,
regardless of whether or not you're taking a medication to lower the fever. Okay.
Right. Yeah. I think you run the risk of just having a more miserable kind of time with COVID. We use Tylenol in the ICU all the time when folks have fevers, and with the fever comes other kind of reactions. You can actually get a faster heart rate associated with fever, and the bottom line is whatever your body's going to do to fight this infection, Tylenol's not going to affect that.
What is your opinion on the hydroxychloroquine and its efficiency that some people are strongly suggesting? But what's the scoop on that hydroxychloroquine?
You were almost there. Hydroxychloroquine. Yeah.
That's what I said.
That's what you said. I mean, that's what you said.
Hydroxychloroquine.
Yep.
Hydroxychloroquine medicine woman?
Yeah, we couldn't afford Oreos, so we would always eat hydroxychloroquines. That's a Hydrox joke. Sorry, go ahead.
Oh, I gotcha. Oreos. Gotcha.
Yeah.
I got it. So, there's a lot of controversy about this, right? Bottom line is we just don't know. There's studies that have shown some positive effects. There's studies that have shown some negative effects. I mean, just yesterday there was a study in Brazil that showed really no difference in terms of ICU needs and severity of disease. There was another study today from France that kind of showed the same. Actually, the one from yesterday from Brazil was actually looking at chloroquine, which is a medication that's related to it, and that study had to be stopped early because of the effects that it caused on patients' heart rhythms, because it's got some side effects that are pretty deadly, and that's why we don't, we're pretty cautious about doing this, about using it, because honestly, the gold standard for figuring out whether a medication works or not for a disease is something called a randomized controlled trial. And so that's basically a study where you get a group of patients with a disease, you give a proportion of them the drug of interest, like hydroxychloroquine, you give a proportion of them placebo, which is basically a sugar pill, I guess you could say.
Or a band from the early 2000s.
Oh yeah, placebo.
What's this band doing here? I'm not getting the medicine, am I?
You just get their CD.
Yeah.
Not even their greatest hits, though, just their latest.
Yeah, we're signing autographs. That's worth less now.
Are they still a band, or are they still making hits?
I don't know.
I don't know.
Either way, they're not effective.
No, they're not effective in preventing COVID. So, but yeah, so then you look at the outcomes between the two groups, and if the patients that got the actual drug are, having better outcomes, then you got a winner.
What's your take on masks? They're being enforced in a lot of areas now, but a lot of studies are showing that wearing a mask won't necessarily make a difference, especially if you don't know how to wear the mask properly. So what's your take and your advice on masks?
I mean, yeah, it's part of the CDC's guidelines now, right? That they're recommending everyone wear them. If you wear them, you should wear homemade ones. Do not wear, surgical mask or N95s or anything like that, because we need those. And whether or not they protect you from COVID, I mean, they might maybe offer some like a very minimal protection. I mean, I think the benefit of wearing a mask is more for preventing asymptomatic spread.
Mm-hmm.
So you may have the disease and not even know it. You're wearing the mask, and so if you're talking or coughing in public, you're less likely to give it to someone else. But no matter what, a mask should never be a surrogate for the 6 feet distance measure. So just because you're wearing a mask, don't think it means you can go out and, party hard.
Yeah. Speaking of the 6 foot distance, have you seen anything, or have you, what would be your take on how long you think it might hang in the air, or how far it can travel? Is 6 feet enough?
Yeah, that's a good question. I think there's been some reports that have said that maybe a little bit, it can go a little further than the 6 feet than we had originally thought. And I think it's always going to be variable, because it kind of depends on the action that the person who has it is doing.
Yeah.
So like,
the projection, like a talking is different than a cough.
Exactly. So like if it's a cough or sneeze, obviously it's going to go a lot further.
Mm-hmm.
But there have been studies that have shown that it can stay aerosolized in the air for about 3 hours at least.
Oh, wow.
Yeah.
Jeez.
Go
ahead.
No, go ahead.
Once a vaccine is developed, will the virus shedding be an issue? Is virus shedding an actual issue for vaccines in general?
So it kind of that will depend. There's different kinds of vaccines. The one where we worry about virus shedding is something called a live vaccine, where we actually inject a less harmful version of a live virus in you. So it kind of, your body reacts to that and builds up immunity based off of, a not real virus. So the issue with some live vaccines is that there can be an occasional, very rare reversion to the wild type vaccine, or not vaccine, the wild type virus, the virus that can cause the actual illness. And so that's what, folks are, that get very worried about. This is like this is fodder for like the anti-vax, this is why something that they always bring up in their arguments. But it's not common. And actually more often than not, when you get a vaccine and then you get sick afterward, it's probably because you didn't, it depends again on the vaccine, but if it's a live vaccine, it's most likely you probably got exposed to a separate virus. But if it's an inactivated vaccine, no vaccine is ever 100% efficacious. So we always have to realize that. So we'll have to see what happens with SARS-CoV-2.
I mean, I'm going to get the vaccine just because I want to be better at chess and counting toothpicks. Now, is this something that if they do develop a vaccine, is this something I'm going to have to get a vaccine for every year? Like, is it going to cycle through like the flu?
Yeah, so we don't know that. It's way too early to know whether one vaccine will be enough. That's always the goal in vaccination, right?
Mm-hmm.
That you give one vaccine and it's got a prolonged kind of immunity. That brings up another good point, is that even though you get a vaccine or you get COVID and then you check antibodies, there's a difference between having the presence of antibodies versus having the actual titer of antibody that will prevent you from getting infection later on. So having antibodies after infection doesn't necessarily mean you're protected. So so yeah, we'd have to see with these vaccines that are in production. There's about 70 or more that are being studied right now, and one of them, one of them is actually being studied here in Seattle. It's as part of the NIH. It's a we'll have, I think we'd have to do some studies that compare what your immunity is like after the vaccine to what your immunity is like after natural infection too.
Mm-hmm. A strong immune system seems to be a factor in resisting or recovering. Is that true, or is there evidence to support that? And how could we build our immune system besides general things like eating right or getting plenty of sleep?
Yes, that's true. The folks that are at risk are, again, the folks that have or that are at risk for bad outcomes, rather, because everyone's at risk for infection. Even the young, the old, babies, pregnant folks. Anyone can get infected. But in terms of outcomes, those with chronic conditions like diabetes, heart failure, COPD. Technically, those are immunocompromising conditions. And actually, the biggest immunocompromising condition, or the most common that no one can avoid, is aging. As you get older, your immune cells go through something called immunosenescence, and that's basically when your cells just don't work as well as they used to in terms of combating virus. So unless you're Benjamin Button, there's not much you can do. Or a vampire. There's not much you can do about that.
Or Paul Rudd.
Ooh,
yes.
He's a national treasure for sure.
Yeah.
I want
Nick Cage tried to steal him.
Yeah.
Yeah. Oh, gotcha. There's not much else you can do otherwise to build up your immune system. That healthy diet does matter, but you also have to realize it's not just the diet. You should try to attain a healthy weight. As I mentioned, obesity is a risk factor, and the other thing that folks can do is get updated on all their other vaccines. There's some studies that show getting vaccines can actually help protect you from infections other than the one that the vaccine is for.
So they can kind of build off of each other and offer you a little more, a better chance at immunity. Not necessarily immunity, but protect you a little bit more.
That's right.
So kind of building off of that question, let's say that you had two people that essentially exactly the same in terms of, their immunity. Let's say that they're not immunocompromised, that they're both essentially exactly the same, identical in terms of health, and they both got it. Is there one thing that if one person did it, that they would have an easier time if they got it, if they did something different than the other person, that could give them an easier time, or would prevent them from having this really bad outcome from COVID?
Yeah, that's a tough question, actually, because
I'm sure there's not, but
yeah. Well, it's,
like, have you seen anything where you're like, these two people seem pretty similar, but this person did this, and maybe they didn't end up quite as bad?
Well, that, again, we see it sometimes in young folks, that are less than 50, less than 30, and there's just needs to be more studies to see whether there's even something genetically a predisposition to it or not.
Gotcha.
So there's a lot of variables that we just don't know about.
So basically, we don't know enough about this, so don't trust somebody saying that, oh, go get our spa treatment with a vitamin C infusion and that will protect you.
Yes.
Or send me money and I'll pray it away.
Yeah, or that too. I just asked that because apparently, like, here, hometown, like Arlington, some spa got busted for advertising that they had a vitamin C infusion that would prevent or protect you from COVID.
Yeah, that's not.
You got a happy ending with that?
I guess. I don't know.
And so they are actually doing infusions where they set you
I don't know. It said
because
something
you
like,
went. I know you
did.
went.
I did. I just sat in a dark room and just listened to Vitamin C's. Was that graduation song?
Oh yeah. You know, that's the cure for all. So.
Yeah. But yeah, they were doing some kind of vitamin C treatment. I don't know if it was an infusion or not. But they were just doing some kind of treatment, and they got busted. And somebody said like, "Hey, you can't say this. You cannot say that vitamin C is going to keep you from getting COVID-19." And of course, here in Arlington, so hometown proud. Are people who have recovered developing antibodies? This person said they've seen a few articles talking about people contracting COVID-19 a second time and a second wave of infection through China with worse clinical outcomes, and was wondering if there was any truth to that.
Yeah, we talked about it a little bit already. There's some folks that are getting reactivation in some Korean studies, and the antibody thing. You know, there's a difference between having the presence of antibodies and having a protective level of antibodies. So we just don't know that much about it. And actually, there's a whole bunch of antibody tests that are kind of in development right now, and the FDA has actually have done one of the most unusual things where they have given emergency authorization for pretty much anyone to put out a test as long as they can prove that it works in the lab, but it doesn't necessarily need to work in humans. And so as we're using the test more and more, we're actually learning if it even works. That's how bad it is right now. But you know, so to that, actually the test that most folks are using to actually diagnose the disease, where they stick the swab in your nose or whatnot, you know, it could be as low as a 60 or 70% sensitivity, meaning you might miss it about 30% of the time.
Wow.
Now, what about to circle back to clothing? Do plastic gloves help? I've seen where they're making people too comfortable, and they don't wash their hands or practice proper face touching etiquette.
Yeah, I think washing your hands is enough, and just being smart about it. You know, if you go out and you have to, for some reason, again, we should be limiting the amount of times that we go out. But if you have to go to a grocery store and you're pushing a shopping cart, wipe down the shopping cart, and you know, do what you got to do at the end of your shopping. You know, go wash your hands if you can. Use hand sanitizer if you have it. Do it especially before you touch your steering wheel or anything like that. And then when you come home, wipe down surfaces. Gloves, unless you know how to use them, yeah, there is a potential that you can be using them incorrectly. The same with masks, actually. You're honestly not supposed to be touching the front of your mask, because that's supposed to be the most likely contaminated part of the mask. You're supposed to use it only once a day, and then once you come home, you take it off, you put it in the washing machine, and so hopefully you have several on hand. So that's the kind of downside with supplying PPE to the public, is they just don't know how to use it. Yeah,
they might not know how to use it. Yeah. Well, at the very least, even if a homemade mask isn't necessarily protecting you from airborne droplets, at least it might help prevent you from putting your hand in your mouth or something without thinking about it.
It's true.
So how often are you just putting your hand in your mouth, Chris?
A lot, man.
Just like,
I get real nervous everywhere.
My daughter does it all the time. I mean,
just whole fist.
Y'all should hang out.
So apparently tigers are getting this shit. What are the implications there?
Yeah, and with any, like, that can cover everything, because I
Somebody
know
else asked about another animal.
Yeah, dog. I've heard cats are getting it, and I know that cats can get the cold, like our cold, and vice versa. That would make them susceptible to getting COVID-19.
So when I mean, the whole thing started from an animal origin, actually. So so we can go ahead and dispel all these lab rumors. You know, it wasn't made in a lab or anything like that. It came from a bat. A bat. There was a potential that maybe a separate animal called a pangolin that is similar to like an armadillo.
Pokemon.
Yeah.
You said penguin wrong, Benedict Cumberbatch.
Yeah, I mean,
Spell it. Do it phonetic. Pangolin.
Pangolin.
There you go.
Pangolin.
Pangolin.
Stage. Pangolin.
There was something that happened weird, and it was probably in one of those wet markets. You know, maybe a bat peed in a pangolin's food or feces, or who knows.
Or a bat dropped a banana and a pig ate it, and then Gwyneth Paltrow ate the pig.
Yeah. Yeah, I love that movie. That actually, that's a great movie. It's a good movie.
I like it a lot. Contagion, if anybody's wondering.
I thought you were talking about Great Expectations.
I was talking about the Gloop Netflix thing.
Gloop. Actually, that's the cure for COVID. Did you not know that? Goop.
I gotta put an egg up my butt.
If you can get it up there,
it's got to get past the pine cone.
So eventually it spread over to humans, and then so when it spreads from an animal to a human, it's called a zoonotic infection, like zoos, like the word zoo. And there's a possibility that humans can spread it to animals. Sometimes animals don't get symptoms. It seems like tigers might have symptoms, and cats in general. Dogs can get symptoms too, but not as severe. But the main implication, I guess, for all this is that they're just another reservoir. So if we
you said our name.
We did. Woo! Do I get like paid or something?
No,
we do.
We haven't even gotten paid.
If we end up wanting to make sure that everyone is immune, and we'd probably have to make sure that that all the animals are doing okay. And I mean, I guess we're lucky that we're not all Joe Exotic or whatever and own tigers. And just don't make out with your pets for a while, Andy.
Damn it! I did have speaking of making out with my pet. I love my dog very much, and I haven't taken her to the dog park because I heard that the dogs can have it on their fur. And I love petting dogs. So, like a park, they say is safe as long as you're not jogging behind somebody and they're coughing their head off. But are dog parks really that safe where your dog might be rubbing up, getting that gross dog's COVID germs all over my dog, and then it comes over and I kiss my dog in the face because I love her beautiful, cute little face?
Yeah, so again, try to refrain from making out with your dog. But if you have to, I think
wear a mask. He has to.
Wear a mask. We don't know that much about, again, the animal transmission thing. It seems that dogs don't shed as much virus from what I've kind of read briefly, but I think after you come home from the dog park, wash up really well, and again, try to avoid making any oral contact with your dog's skin or fur, or I don't know. If we don't know is the bottom line.
Okay. Yeah. Well, I haven't gone since all of this has started because, man, I'll tell you, because I'm essential. So you and I are on the same page.
Nice. So you're basically a doctor.
I mean, yeah, 'cause I have WebMD too, so
operates on boxes.
Yeah, but so I just go to work and I go home.
Yeah,
and that's it. I'm not trying to see anybody else. I do miss seeing my friends. I mean, I haven't seen you, Danny, because you decided that you wanted tossed salad and scrambled eggs more than you wanted Taco Tuesdays. So you're up in Seattle now. But I haven't seen Chris in like what's in Leap Day. So that was 10 months ago. Because it's April now. Yeah.
I mean, you're doing well. I appreciate it. You're part of the good fight.
Oh, thanks. But I work in a returns department, so people have said, well, something you might send out might save somebody's life in a respirator. And I said, well, I work in the returns department, so there's absolutely no way anything I'm touching is helping anybody.
So you might actually just get back something that somebody that had COVID-19 had.
Oh, dude, we were getting boxes from China while it was going on, and we were raising our hands, and they were like, just leave it aside for a week. It'll be fine.
Like, hey, Andy, go check in this big box of coughs.
Yeah, but oddly enough, the company is global, and they haven't had one person test positive. They say that because probably other people have had it. There's a couple more questions. There's an article saying that marijuana makes you vulnerable to COVID-19.
Yeah, I hadn't read that. You know,
it was in High Times.
Probably right. That's probably why I haven't read it. And I
High Times will be printing that.
There's some pretty reputable scientists in those.
Like, guys,
journals, right?
Edibles, don't smoke it.
Yeah.
I mean, that is a good good alternative, I think. Because honestly,
if you have to do it,
if you have to,
who does?
Patients that smoke cigarettes are at risk of COPD. We don't really know that much about marijuana usage if it leads to lung problems. There's a possibility. But I think the big thing, even with the bone marrow transplant population, again, is the patient population I see most. There's a risk of fungal pneumonia that it's related to smoking marijuana. So, and there's been some studies recently that if you get COVID, you're at risk of getting fungal pneumonia. So, I think it's if you can avoid it. If you can do edibles, I guess do edibles. I don't know.
So you heard it right here. Doctor said, do edibles.
Well, there's a follow-up question. There's a follow-up to that question, which says, if I can't smoke marijuana and cigarettes, how do people know I'm cool? Sunglasses? Question.
Because you have to have the cool at the end of the MD, right? Didn't we? Is it cool guy?
That's right.
CG,
yeah.
CG, yeah.
Yeah. So what else can I do to make sure I won't get sick? What if I have to go to work?
All of the measures that we've talked about already, staying 6 feet from folks. A lot of places here in Seattle are instituting a policy where no more than 5 people per room, if that's possible. But if you have to be around other folks, wear a mask if you can at work. If some places are making it kind of a policy as well. Wash your hands constantly. And actually, washing your hands works really well for this virus in particular, and as opposed to hand sanitizer, because just mechanistically, it probably works better. That's about it. You can't do much more. I mean, if you're working with the public, if you're in the food industry or things like that, I think it's very important to keep up on a lot of these practices too, because you're at risk of spreading to others if you do end up having it and you're asymptomatic.
Go ahead, Chris.
Our last official question here. Some reports say COVID-19 has been around since December and January. I was sick in January. Was it COVID-19?
Yeah, that's, I've seen a lot of those questions online, actually. And I've seen questions about, I was sick in December. I was sick in November. I'm pretty sure I had COVID. It's not likely. It's not very likely. And the reason I say this is, was actually, there's been some based off of some of the studies that have been done here, actually in Seattle, we had that viral surveillance program that I was mentioning, the Seattle flu study. And we actually looked at a lot of samples from January and February. Like when I say a lot, I mean thousands of samples from folks. These are folks that signed up for our study because they had actual respiratory symptoms. They thought they had the flu. And we went back and we tested them for COVID. And other than the people that actually got diagnosed because they came into the hospital, and I think our first case was around January 21st or so, no one had COVID in January. And there was a handful of cases in February. So based off of that, it is very unlikely, and based off of genomic kind of tracking that we can do with some of these with these viruses, it's likely that it was introduced sometime in mid-January. And I think one of the big things that that makes this less likely that someone had COVID earlier than our official kind of estimate in mid-January was we would have seen a lot more deaths earlier on. So that's just not the case.
Mm-hmm.
My cousin says that you can get COVID-19 from 5G network. Should I stop talking to them? No, but really,
specifically, yes, on 5G. Yeah, it is 4G or LTE.
As a doctor, can you get it from 5G?
No. And I don't even know
no more explanation needed.
Okay, let's just no.
And it wasn't created in a lab.
Definitely wasn't.
It wasn't used as a weapon by the Chinese.
No.
Cool. Was it on a U.S. military base and then the Chinese got it?
Nope.
Great.
Man, that's it. That was all the good questions right there.
Yeah. The 5G one doesn't make any sense to me at all.
No, I actually haven't looked into that. I don't even know how they even relate.
It's just that people are stupid.
Oh, that's how it relates, I guess.
Yeah. Okay. But this is something that needs to be taken seriously.
5G?
How much is the media blowing it up? Because I feel like it's maybe 70% as bad as they're saying.
Yeah. I think they might be. I mean, I saw a report about one news station that was actually using footage from Italy or something. And it wasn't, so that stuff is the most extreme forms of blowing it up, but it is bad. It's nowhere near getting resolved soon. Unless you actually are seeing, patients kind of on a regular basis and what happens as a result. I mean, it's sad, to see folks that are on the younger, on the younger side, and they're again less than 50, and they're on the ventilator, and I think some of there's been some celebrities that have passed, and I think what makes it hard for some people to grasp is that a lot of people don't have someone personally they know affected by it. But when I think it's in some ways it's good for it to be reported when someone that you do know is affected by it, so that that it's a real thing to worry about. So but yeah, media can do a little bit better, and I think that there needs to be a lot of more representation about from experts, and some news networks are better at that than others. Some folks get kind of second-rate experts. So
Well, I mean, when he's up there doing the press conference, you're not talking about anybody specific.
Well,
are you saying I should trust doctors and not people who used to host a reality show?
I mean, Dr. Oz did both, right?
Dr. Oz is a piece of dog shit. He has a higher death rate in those celebrity rehab houses than you should have in any rehab. Yeah, he's a piece of shit.
Recently, actually, he had been on our side with telling folks to be wary of hydroxychloroquine.
Mhm.
So good on him for that. But yeah, I agree on some of the other things that he reports on, and there's other news or other doctors in media like Dr. Drew and stuff, and that's not their purview or their specialty. Dr. Drew is a psychiatrist, and I mean, you have to take what they say with a grain of salt.
Well, Dr. Dre said this shit's fucked up. So
yeah, well, I believe Dr. Yeah, he might know. I mean,
he wasn't talking about this.
But that does bring up a good question. So what news outlets would you recommend? Like where could people go to get good information that you can trust?
Yeah. So I have a colleague who has been working on a website that is kind of geared towards the general public that folks can potentially get some information from. It's covid-101.org. And so it's got some answers to some common questions there.
Okay.
You can go on, I know this sounds kind of interesting to say, but you can go on Twitter, because there's actual health professionals that use Twitter. I myself use Twitter as well. If you look at the hashtag, either COVID-19 or ID, meaning infectious diseases, Twitter, there's a whole bunch of health professionals that, that are kind of reporting about studies that have come out and what their thoughts are about them. And that's where people should probably be paying more attention to. Yeah.
And just, I guess in closing, how close are we to this being over?
What do you mean by over? Like everything back to normal?
Not back to normal.
But just like being able to go out? Gotcha.
Yeah.
I think there's going to be some things that we need to see, I guess, before going further in like reopening in the nation, in terms of, even here in Seattle, we're on a plateau. We're not. I know there's been some stuff in the news that we've passed the peak, and that might be so, but we haven't gone down necessarily. And I think that's something that we would want to see in places that, before we start opening them up, that they're on a downtrend in terms of cases. That'll help us in terms of hospital resources, so that if there's ever a little mini outbreak in like a nursing facility, we can keep up with it. But in all honesty, again, this thing is going to pop up again. Maybe sometime this winter, maybe sometime next year, maybe sometime the year after that. It will be multiple cycles. It's been introduced into the world now, and it's there, and unfortunately, until we get a good handle on a vaccine, it could still have the same consequences that it has now later on. So I think seeing that downtrend is important, is one. We don't necessarily have to wait for a vaccine to open up things, because as you probably have heard, it's gonna take about 12 to 18 months for that to happen.
Mm-hmm.
I think folks can be strategic about how they open places up. If we offer a broader testing to try to pick up as many asymptomatic carriers as much as possible, and then do actual case tracing for those carriers. So all the contacts that they've had, and isolating them for at least a couple of weeks. And so if we do this kind of strategically, eventually we be releasing folks out into the workforce. I think the antibody tests that we've talked about earlier are going to be important, because it's going to show us who actually, has seen the virus already. So they may be immune to it later on. There's been a big talk by some folks about herd immunity, and I just I want everyone to make sure that they know that is probably not possible anytime soon, because in order to get that, you need at least 60 or 70% of the population to have had seen the virus and have antibodies that are protective of it. And we can't do that safely by naturally infecting everyone, because then that's going to kill everyone pretty much. And so a vaccine would help that for sure. I think that we shouldn't be expecting major sporting events or major like big concerts or anything like that. Probably for a good maybe half year to a year, maybe longer. There was a report today that we should probably not expect things to be normal until like 2022 or something. So it's hard to say, but we need to be cautious. We need to, act accordingly, according to what experts and what the scientists say, with what the models say. A lot of these models are based off of keeping some of these social distancing things in place. But I think eventually, sometime this year, we could start to see potentially folks opening up again.
So just because things haven't gotten as bad as they projected doesn't mean that it's over. It just means that we're doing a good job because we're staying inside.
That's right. That was the whole point of all this.
Yeah.
And it's important to remember that. I think that some folks have been, a little bit angry just because they think, you said it was going to be bad. It never got bad. It's because of the things that we did.
Exactly.
Right.
Yeah.
One thing that I always like to remind people is that, doctors and epidemiologists were well aware that, yes, there's not just the repercussions of keeping folks sheltered in now, and that, yes, people are going to lose their jobs, and maybe it may lead to more psychiatric issues, maybe more relapse of substance abuse. And we don't take this lightly. We're not doing this because we want to feel better about ourselves. We think that this is the best thing for everyone, and we are aware of those consequences that can happen as a result of it, and they're unfortunate, but we wouldn't do this if we didn't think it was necessary. And as soon as we think that it's safe to open the country back up, then we will say so.
So you're not just flexing your big doctor muscles? Oh, all right.
No, I don't have any of those.
All right. Well, I guess, there's a million more questions, but we don't want to.
Can we do this again if necessary?
If there's enough interest, if people have other questions. This is going to be around for a while, like I said, and there's going to be more things that pop up.
Yeah. And there might be new information. If you're open to it, absolutely. Maybe in a few weeks we could sit down and do this again, tackle some new questions. But I think a big question from us is, since we're primarily a pop culture entertainment podcast, what are you doing when you get home from work? How do you turn your brain off? What are you doing to entertain yourself and keep your mind off of everything outside?
Yeah. Well, I definitely try to enjoy time with Casey, my wife, and our baby Lily, who's 6 months now. And but we'll watch. What can you do? Are you watching TV? We just started Tales from the Loop. It's pretty cool. It's an awesome series. We're just kind of, as things get released online, I guess. She finished I didn't actually watch that Tiger King thing. I was just joking. I did.
I was going to say that we forgot the most important question.
Yeah.
Carol Baskin killed her husband, right?
But that's what I've heard. That's what Casey says, and I totally believe everything she says. So if she says she killed him, then she killed him. Yeah. And then I'm kind of stoked for all these movies that have been coming out, so that you can watch at the comfort of your own home.
Mm-hmm.
Like Trolls, the world tour.
Yeah, I've watched Onward.
That's the big one
times.
you've been looking forward to.
No, we actually watched Onward. Was really good.
Yeah, I liked Onward a lot.
Almost made me cry a little bit thinking about my brother and stuff. But also, The Hunt was good.
Well, I want to thank the people who asked questions. Misty K, Doug Bayshore, Maria Perez, Priscilla, my dad, Mark Valentine, Andy Ortiz, April Mauser, Josh Brimhall, and the people who sent in messages. And Danny, I'd like to thank you very much for taking your time. Thank your wife for us too, for bothering you and taking you away from her.
Yeah, no, I'm happy to be here. We should do it again if people are interested. And
yeah, absolutely.
I miss you guys. I really do. I
miss you too.
Yeah, we should have a game night sometime.
Yeah,
we
absolutely.
should. But if this ends, I'm never using like video messenger ever again.
I'm so surprised we didn't get Zoom bombed. What? I was waiting for that.
What's Zoom bombed?
Just wait until we stop recording. Andy will whip it out.
Oh, okay, yeah. Yeah, you guys want to see my butthole? That's cool. It says C and then my butthole and then VID.
I got it.
COVID.
Where's the 19?
You're assuming yours is perfectly.
That's my cock and balls. Remember I said I was going to be good on this so that way we can post it and people can listen to it with their family? You're going to have to bleep all this out.
I only expected about an hour out of you, so we're good.
I only said shit once.
Well, twice now. All right, folks. Until next time, thank you, Danny.